Hello, I'm Shivam, and in this video, I'm going to walk you through how to implement testing in your practice step by step. We're going to cover everything from ordering kits to messaging testing to your patients, collecting saliva samples, reviewing results, and following up with patients. So let's dive into each step. So the first thing is ordering your Bristle test kits, which you can do directly from your online professional account with Bristle. The kits come in packs of 10 and usually arrive within 3 to 5 business days after ordering. The price for clinicians is either $100 or $120, depending on your monthly volume, and this includes shipping both ways. As far as the pricing goes, you only pay $15 upfront per kit, and then the remaining $85 to $105 for the lab processing is billed at the end of each month only for the number of samples you send in. So if any given month you don't send in any samples for processing, there's no additional charge for the lab cost. The next step is identifying what patients your office is going to be testing. And typically, there are 3 buckets that our partner practices test within. So the first is new patients, which is useful to get a baseline to pair with your clinical assessment and uncover any hidden risk that might allow you to get ahead of disease progression and focus on prevention. The second bucket is any patients with oral conditions, with gingivitis and periodontal disease patients and caries patients being the 2 most common. The testing allows to determine severity of the disease based on bacterial levels. And the third bucket is patients with systemic conditions like diabetes, heart disease, GI issues, and cognitive decline. Because of the oral systemic connections that exist, screening these at-risk patients can help them better manage their overall health. Once your patient is in the chair, you need to introduce testing to them. And we recommend framing Bristle testing or salivary testing just like blood work from your primary care physician, but for your mouth. We even have a patient messaging guide as a separate resource that you can use, which includes suggested scripts for different types of patients, like a new patient versus an existing periodontal patient. The goal with this messaging is to explain that salivary testing lets you detect the bacteria contributing to both oral and systemic diseases so that you can ultimately personalize their care and determine the best course of action to get them healthy. Once a patient agrees to testing, the next step is to collect their saliva sample. It's very important that the saliva sample is collected before any cleaning, any use of mouth rinses, or anything else that could actually contaminate the saliva sample. You can collect the saliva sample after radiographs or probing if it's sterile. And many practices actually use these diagnostics up front to help determine and convey the need for testing in order to dig deeper into the root cause of these symptoms. For sample collection, make sure patients haven't eaten, drank anything, or used any oral care products at least 30 minutes prior to collecting the sample. This usually isn't an issue by the time the patient's sitting in the chair. There are a few other important timing notes for collecting samples, like waiting at least 2 weeks after any cleanings or treatments like an SRP, and waiting 4 to 6 weeks after any antibiotic use by the patient. These types of interventions can alter the microbiome, so waiting that 2 weeks or 4 weeks can help allow the microbiome to return to its baseline state before testing. And we do have a more detailed sample collection guide that gives you insight into when to collect the sample. The actual process of collecting the saliva sample is very easy. It only takes about a minute, so it doesn't disrupt your appointment or your existing workflow. And the step-by-step process is starting with taking the collection tube and removing the cap, inserting the funnel, letting the patient spit into the funnel and collect the saliva in the tube until it's about 2/3 full, which is usually just about a milliliter of saliva. Then you remove the funnel, screw the cap back onto the tube, and then shake or invert it 5 to 10 times. Then you place the collection tube in the clear sample bag, put it back in the return mailer, and ship it to the lab for processing. And each kit comes with a detailed instruction guide that goes through these various steps. After collecting the sample, the next step is to register it in your online Bristle account before you ship it back. And this is a very critical step because if the sample isn't registered, we won't have any idea of who it belongs to and you won't be able to access the results. So it's a very simple process. You log into your Bristle account, select Register Kit. The three main pieces of information that you'll need to enter are the patient's name, the date of birth, and the unique kit barcode that's on both the test kit and the tube, starting with BH. Optionally, you can add in the patient's email address here if you want to be able to share results with them later. And you'll also indicate if you completed any radiographs or probing prior to collecting the sample. Then you just select Register, and you'll be able to verify that the sample is registered by looking for the patient within your patient tracker. The next step after registering the sample is to send it back to the lab for processing. So each collection tube has a clear liquid stabilization buffer that's already in it, and this helps preserve the sample during transit. So there's no need for refrigeration or using any ice packs. The sample will stay stable and preserved while it's in transit back to the lab. And each test kit also comes with a prepaid ground shipping label that you can use to send off via FedEx, but we highly recommend using 2-day return labels from your Bristle account to get faster turnaround time for the test results. There is no additional costs to using the expedited 2-day return shipping, and we found that practices using the 2-day shipping versus the ground labels get test results back on average 3 to 5 days quicker. So again, that is why we highly recommend using the 2-day return. And to do so, all you need to do is go to your Bristle account. You'll click on Shipping Labels. You'll select all of the samples you're sending in to the lab within that envelope, and you can include multiple samples in one mailer. You'll be able to generate one label per day. So if you collect multiple samples in a given day, you can include them all in one return envelope. You'll then choose your carrier of choice, either UPS or FedEx. You'll confirm the address you're shipping from, and then you'll select Create Label, which will generate a PDF of the 2-day return shipping label that you will then print and then just affix to the return mailer envelope on top of the existing label. And then just ship it back via UPS or FedEx, whether that's a pickup or dropping it off at one of their locations. For billing the patient, we leave that to your discretion as far as the amount, but just for some context, if a patient were to order directly from Bristle online, they'd pay $169 for the tests and then an optional $75 for a consultation, coming out to about $245 total. And most of our partner practices charge somewhere between $150 to $300 for the test and consultation time. Some will charge higher and some will charge even less. It's totally up to you. Some practices will include the tests as part of every new patient exam, or they'll bundle it within any cost for treatment, such as periodontal treatment. And you can also include it in membership plans if that's something your practice offers. And one other note is that the testing is FSA and HSA reimbursable, so you can always mention that as an option for your patients. Most major insurers cover only a small portion of the testing, if anything at all, but the ADA has released guidance in 2025 on billing codes to use. So there's 0411, which is for the collection prep of the saliva sample, 0419, which is the analysis for the saliva samples, and then they also recommend using 9999, which is for testing that provides insight into monitoring and other wellness metrics like gut health and nitric oxide. So you can use this code, but just specify what's being tested for. So we've collected the sample, we've registered it, we've shipped it back to the lab, but before the patient leaves, it's important to let them know what they can expect next. So what is that follow-up going to look like? And for each practice, that will differ. It could be an email from Bristle with their results and care plan in 2 to 3 weeks, which is basically you just sharing the Bristle report. It could be a follow-up call or an email that's going to come from your office. It could be a review of the results at their next appointment, whether that's a treatment appointment that's scheduled out in a few weeks, or a cleaning that could be in 3 to 6 months. So really just setting expectations for the patient to keep them engaged and make sure they aren't confused when they leave the office. Once the sample has completed processing at the lab and the results are ready, which is usually in 2 to 3 weeks, you'll get an email notification. And what you can do to access the results is simply log into your Bristle account online, go to the patient tracker, find the patient's results you're looking for, and then open the test report. In this video, we're not going to go into depth about how to review test results, but we do have a number of other guides as well as videos for additional training on how to interpret test results, and you can find those in our provider resource hub. If you ever want help interpreting a patient's results, we do offer free one-on-one calls with our Bristle clinical coaches, and they can help walk you through a patient's report, help you integrate it with your clinical findings, and assist with care planning. You can book these directly through your provider account online under resources and support, and we highly recommend taking advantage of these, especially when you're just getting started with testing for your first few patients. After reviewing the test results, the next step is to review, update, and finalize the patient's treatment plan. So each patient's test result comes with a pre-filled home care plan from Bristle, and that's based on the microbiome test results. The in-office care section will always be left blank as we leave it to the discretion of the clinician. Importantly though, within the treatment plan, everything is editable and customizable. You can swap in your preferred products or routines and then add in whatever in-office treatment for that patient is relevant. And you can also create treatment templates. So let's say you have a standard protocol for all of your gingivitis patients or all of your high caries risk patients. You can create one template for that treatment and then quickly add that treatment plan to any future patient results, all just with a simple 2 clicks. Once you select Finalize Care Plan, it'll be marked complete, but you can always go back and edit it if needed. After reviewing results and treatment planning, the next step is to follow up with the patient. Again, this could be just sending them their Bristle test results. It could be a call, an email, or a discussion at their next appointment. We encourage you to focus the conversation on what matters most to the patient and any changes to treatment or steps they need to take to address those concerns. There are 2 ways you can share the results with patients. So the first is via the Bristle dashboard. If you go into your patient tracker, you can toggle the share button so that those test results are shared with the patient. And what that does is causes Bristle to email the patient with a link to access their own Bristle account where they can log in and view the test results online. And the other option is to simply download a PDF of the test results, and then you can email it to the patient or you can print it out to be able to show them next time they're in for an appointment. So for this patient, we've gone through their baseline test, we've reviewed the test results, and we've implemented the treatment plan. So the final step is to retest. Our guideline for retesting patients is anyone with active symptoms or disease, retest them in 2 to 3 months after treatment, for example, scaling and root planing, or even any home care changes. And this time allows the microbiome to stabilize so you can truly assess progress and understand what their new baseline is. If the patient was generally healthy, you might end up retesting them yearly or every 2 years just for monitoring purposes. And the importance is retesting can help confirm treatment success. It can determine if additional treatment or care is still needed. And finally, it helps motivate patients by visibly showing them progress and improvement within their scores over time. And lastly, we highly recommend educating patients on salivary testing when they're not in the chair so they can understand the value and become curious on their own. So a few things that we recommend is to include testing as a service on your office website, which can help attract new patients as well as differentiate your practice. We also have email templates which you can use to notify existing patients that you now offer salivary testing and encourage them to ask about it at their next appointment. And for all new partners, we'll also send you in-office marketing materials, which include laminated sample reports that can be used in the operatory to show patients what they're going to receive, pop-up flyers that can be put up on the front desk or in the waiting room, as well as patient brochures to hand out. So there you have it. That's the full process, step by step, for testing a patient and how you can start using the test within your practice. If anytime you have questions, you can always email us at providersupport@bristlehealth.com. And for more training resources, interpretation guides, and care planning tools, you can head over to our provider resource hub directly from within your Bristle dashboard. We're incredibly excited for you and your team to get started testing and looking forward to supporting you every step of the way.